Well, hello. Welcome to the integumentary system. Now, I just want you to know something here. This is what we usually do on the last lecture day, is I bring you, um, you know, bagels and fruit and veggies and outside, of course, but I owe you a bagel, is what I'm trying to say. So when next fall, okay, I owe you one. So, well, today we're talking about probably one of the most, as far as problems that you're going to see in practice, wherever you work, you're probably going to see problems with this system more than any. There are days in the summer where I feel like all I do is deal with skin problems. And one of the clinical applications this week is about allergies. And so certainly in the summer, spring and summer and fall, we get a lot of flea allergies and airborne allergies. But there are so many. I mean, we aren't even going to discuss a fraction of the skin problems. In your discussions this week, you'll be talking about some. But for now, we'll just talk about the skin itself, a very amazing organ. So we'll talk about, just to begin with, we want to know, well, what is it? Why don't we just say skin? Why do we say integument? And then what are the functions of it? It has some functions that may surprise you. And so when we say integument, we're referring to several things. These three layers here in particular. We have what's called the epidermis, the dermis, and then the subcutaneous. And then there's all these structures that we associate with them. We've got hair, so that's part of the integument. We've got various glands, sweat, or we'll call them apocrine and sebaceous glands. You've got this thing called the subcutaneous layer. That's not part of the it's not part of the skin. Skin would just be epidermis and dermis, but that's considered part of the integument. We've got feathers and shells and scales, right? That's all part of the integument. Horns and hooves and foot pads and all these other things are all part of the integumentary system. And it's also a kind of an amazing system. This is the largest organ in your body, is your skin. And it's unlike some other tissues, we find all four types of the basic types of tissue here. We've got epithelial tissue, connective tissue, muscle tissue, nervous tissue. It's all in the integument. A lot of what we'll talk about will be mostly the epithelial tissue, but we'll talk a little bit about connective tissue too. Why? What does it do? Well, certainly it protects you from drying out, but not just that, it's protecting you from ultraviolet radiation, from infection, and we'll come back to that a little bit later. I think it's very cool. There are certain hairs we won't say a lot about, but you have certain tactile hairs. You've got the ability to detect heat and pressure and pain. So there's certain important sensory functions. The skin is very important for camouflage for certain species. And I'm going to show you some pictures and see if you can spot the animal. Okay, so this first one, of course, this one's easy. This one's probably pretty easy too. Okay, now this one, take a moment. Can you spot the little creature? I'll give you a hint. It's a bird. See him? There he is, right? So the integument also helps to regulate water and salt and organic wastes, right? So when you sweat, you're actually you know, we don't think of the integument as a major way to get rid of wastes, but you do get rid of some wastes and things through your skin. It can regulate body temperature. If you've ever gotten goose pimples, that's thanks to a little muscle called the erector pili muscle, and that'll make dogs and cats' skin stand on end. But it's actually helping you to and dogs and cats, helping them to trap heat against their body. It's kind of cool. Your skin helps synthesize vitamin D. That's a very important vitamin. It helps you absorb calcium from your digestive tract. Um, it just helps make the inactive form. And then the kidney actually plays a role in converting it into an active form. Like we said, you're going to have a lot of patients with skin problems. There are so many. This little manatee looks like someone hit him with an outboard motor. You'll see what's going on with this cat's nose and this dog's skin and his skin and that ear and what's that growing under the tail there. You'll see it in reptiles. Sorry, that is not what reptile skin is supposed to look like. Some problems are kind of a nuisance. You know, why does my dog stink? Why does my dog itch? Very frustrating, maybe not deadly. You'll get questions, right? This understanding the integument helps you answer questions. Like clients will come to you to say, oh, I'm looking for a hypoallergenic breed. And I'll let you decide a little bit later about the hypoallergenic breeds. Clients will call you about shedding. Then they'll call you about why the hair's not growing back. There are some skin diseases that are actually kind of dangerous and potentially deadly. So it just runs the whole gamut. I interviewed Julianne London. She works for the animal dermatology clinic in Rockland. And I just asked her to tell me her thoughts about the role of the RVT in general practice. And I thought what she said was great. Now, it starts kind of abruptly, and I don't really have this timed to the images. So bear with me. I might go forward and backwards a little bit, and hopefully you can hear her. But technicians play a critical role, as you'll see in general practice. Okay.
How many clients and pets you see come in with some sort of skin or ear disease? I think it's really important to be able to help your general practitioners, you know, be able to recognize yeast or bacteria or even mites on slides, because I know at a lot of general practices, the technicians are the ones reading those samples. So it's really important to be able to differentiate cocci from malassezia, so that way we get the appropriate diagnosis and, you know, they're prescribed the appropriate medications. Because I know a lot of general practitioner doctors that don't even look at their cytology slides. They rely on the technician to know what they're, you know, to know what they're reading and what the sample result is. Especially when it's, you know, cases like Demodex, we don't want to say, oh yeah, they have Demodex, but it's just some weird hair fragment or something like that. And even knowing how to collect samples is important as well, because I've worked in general practice and in dermatology where sometimes you're having to collect the samples, and if we don't get an appropriate sample in the appropriate spot, we might not get the correct diagnosis as well. It's definitely important, and I've seen dogs come in miserable, horrible shape, just itching, you know, chewing, biting at themselves nonstop. And when these clients come in a month or 2-3 months later and you hear from them, they say it's a life changer, because a lot of times it's not just quality of life for the pet as well. When you see the severe cases come in, it's also owners. Also, they're not sleeping, they're frustrated, because skin and ears is something you can see. It's not, you know, oh, maybe they have some sort of internal tumor or something like that. You can see and smell this wanted to even touch the cat. And that's sad and heartbreaking because they're, you know, they're family pets and we want to do everything to make sure that they're included as part of the family and not just some creepy little creature, so to speak, you know, wandering around the house that no one wants anything to do with. But skin definitely, I think, is very important in being able to recognize things when you're helping the doctors on cytology, as far as making sure we get towards that, you know, correct diagnosis, because sometimes doctors rely so heavily on their technicians just because they're so busy. And also client education, informing the clients on maybe the diseases that their pet has, or and the treatments and proper bathing and how important medication is. And because we want to, you know, have the clients and the pets both have a quality relationship. So it's definitely important, I think, all around.
Yeah, and if you find you really love dermatology cases, guess what? You can become a specialist and go and work for the good people over in Rockland or at UC Davis or in Sacramento. So, all right. So, our objectives. We're going to list the cell types that comprise the epidermis and describe the function of each cell type. List the 5 layers of the epidermis, although there's really not 5 in animals. Describe the process of keratinization. We're going to list the structures that comprise the dermis and describe the function of each. List the structures that comprise the hypodermis. Describe features of common skin cancers. Describe the parts of the hair follicle and explain how hair grows. List and describe the 3 types of hair. Describe the structure and location of sebaceous glands. Differentiate between eccrine and apocrine sweat glands. I'm probably not pronouncing a lot of these words correctly. Describe the unique features of pads, nails, hooves, and horn. Describe laminitis in horses, and we'll be in between all this identifying some common lesions in dermatology. In the notes that I'll upload, there's the quiz thingy, so you can go through those answers. In fact, oh, you know what? You know what I'm going to do right now? Because last time I did this and I didn't even look at my own quiz thingy, and it left out some kind of important thing. So I'm going to look right now. I'm going to look at the quiz thingy. Okay. Yeah. Okay. Okay. Sure. Well. Okay. I think we can. I think we can do this. Okay. Well, to begin with, we're going to talk about epithelial tissue. That's a big part of the integument system, not just integumentary system. Okay, not just skin, but hair and nails and claws and hooves and horns and pads and all that. It's all about epithelial tissue. And you know, we've seen it. It's shown up, and we've talked about lungs. We talked about the simple squamous epithelial tissue. When we talked about vaginal cytology, there's stratified squamous there. The intestines have the simple columnar. The bladder has transitional, like stretch, right? And we classify it in different ways, just as hopefully kind of a review to you. Epithelial can either be a single layer or it can be multiple layers. And when it's just a single layer, we call it simple, like simple squamous or simple columnar. And if it's layered, then we call that stratified. So your skin has stratified squamous. Your mouth, the vagina, it all has stratified squamous. Okay. And then the shape. So squamous just means flat or like a plate. Some are cuboidal, some are columnar. So we can get, I didn't put transitional and pseudo columnar on here, but so we get some things that are just simple cuboidal like that. We can get simple columnar. We can get simple squamous, and then there's stratified. So anyway. And we don't really need to know what apical and basal means. It just helps you know what is on this slide here. Okay, so what is so special about epithelial tissue? Well, among other things, these are tissues that are tightly adhered to each other. They're not like connective tissue where the cells are kind of far apart from each other. They're often good at secreting stuff such as bile and sweat, and some of the glands you'll learn about today. They're very good at absorbing stuff. When they're thin enough, things like oxygen and carbon dioxide can diffuse across them. When they're thick enough, they're very good at protecting us, protecting the skin, the vagina, the mouth, the esophagus. Some are very good at stretching. Again, they form very tight connections with each other. So it's great that the bladder is made out of epithelium. If it was made out of connective tissue, it would never stretch very much. But epithelial tissue, some of it can stretch. In the notes, I also mentioned my apologies. I was trying to keep the slides from being too busy looking. Oh, here we go, sorry. Well, that was it. That was everything. There's sometimes a problem, but that doesn't really concern us. A problem that they lack blood vessels, but that's true, but it's not really a concern today. So there used to be a really very funny gentleman named Groucho Marx. And if you've never seen one of the Marx Brothers movies, I recommend it. And he had a TV show in the 50s called What's My Line? And there was always a secret word. And the secret word today is actually not harmonious bliss. The secret word is going to be mitotically active cells. So we're just going to ignore that phone ringing. It looks like a robocall. And so by mitotically active cells, that's something else that's special about epithelial cells. These cells divide really rapidly. So we're going to be seeing a lot of that. These would be, cells in the skin dividing rapidly. They are mitotically active, right? Not meiosis, but mitosis, where they're making exact copies of themselves. It shows up in hair follicles, new hair is epithelial and it's mitotically active. It shows up in horn being grown and hooves and nails and pads, all mitotically active. So you're going to see that get mentioned, and it'll help you understand some of the special powers, but also some problems that we see. All right, so the epidermis is this top layer here, right? This part here. And then, well, I don't know why I put it, but you can see there's his epidermis, right? What's amazing about the epidermis is it's actually not that thick. If you they're on your own skin, even though it has all these layers, it's really not that thick. And I'll show you some examples later. So again, it's made up of stratified squamous epithelium, but the difference between this stratified squamous and the stratified squamous in your mouth is that something kind of special has happened. I mean, I guess it kind of happens. No, it doesn't really happen in your mouth. Something special happens to these cells as they get to, they all develop down here at what's called the basement membrane. This is very mitotically active. So all these new epithelial cells are made and they slowly get pushed to the top. And as they get to the top, this process called keratinization occurs and they become what are called keratinocytes. And keratin is a very special, hold on, I'm sorry. Yeah, I'll get to that in a minute. And we'll talk in a little bit about what keratin is. So you just have to picture all these cells, even though they look cuboidal, it's still considered stratified squamous. You just have to imagine all these cells pushing cells up, and they die, and all the while there's new cells growing. You'll see in a video here. Again, we get these different layers, and that top layer is all made up of essentially these dead cells that will eventually flake off. And I just put this here to show you, when you give yourself a paper cut, you have cut through the epidermis into the dermis. You'll see later the dermis, that's where blood vessels and nociceptors are located. The epidermis is really, really thin, even though it has all these layers. What happens as cells start to, the epidermal cells are formed down here, and they slowly get pushed upwards, and they change. They become keratinocytes, they become keratinized, and different people pronounce it different ways. But what happens is they give up their nucleus, and they take on this kind of tough, waterproof protein called keratin. Now, keratin is also the same substance that makes up your nails and your hair, and a horse's hoof, and a cow's horns. It's all made up of keratin, a very tough, inflexible protein. And that's what all the skin, your outer skin cells are all made up of. Your epidermal cells are all made up of, they're all filled with keratin. And it's kind of interesting that the cells, the skin of reptiles is so heavily keratinized. It's kind of like the pad of a horse, the pad of a dog's foot is really heavily keratinized. But in reptiles, it's their whole body. And so topical treatments, you can see, are not very effective in reptiles. So here you're going to see it all in action.
The epithelial cells of the epidermis undergo keratinization. The cells at the basal layer, the layer which is attached to the basement membrane and the connective tissue beneath, are cuboidal, and they divide frequently, maybe once a day. Once a cell is pushed up from this basal layer, it only has about 2 weeks to live. During this time, it synthesizes a great deal of the protein keratin, which is the major protein in skin, hair, and nails. Once the cell begins to push upward through additional layers, the cell gradually dies. The nuclei and other organelles degenerate, and so the cell then becomes a dead bag of the protein keratin. The cells are firmly anchored to each other because of the junctions found between these epithelial cells. These cells will typically stay on the epidermis for an additional 2 weeks, and therefore the outermost layer of our skin is made of dead interlocked cells known as keratinocytes.
Right, so he mentioned some of the things we've just said, right? Epithelial cells are really good at sticking together. I forget what he said. They're sort of anchored to each other. As they're pushed up from underneath by new cells, they give up their nuclei, they give up their organelles, they take in or they make keratin. I'm not sure where it comes from. And then the outer layer of skin are these just dead, interlocked cells with keratin. Now, he was mentioning things like 2 weeks and this and that. I don't really know. In animals, we know it takes weeks to go from when the cell is first created to when it's a keratinocyte. About 20 days in dogs. I think the book says in humans it's like 8 weeks, but I think it's closer to 28 days. Anyway, so basically, in you, every 28 days, you're a new you. You're totally different skin. And the dog is a new, well, outer layer is new every 20 days. Well, what's the advantage to this? Why? Why not just have these cells stay year-round? Why this constant shedding? Well, imagine, what if you got some radiation damage to this cell right here, right? Well, that's fine because in 10 days or whatever, 20 days, I don't know, it's going to get pushed up to the top and it's going to flake off. Or what if you got some sort of a bacteria or a fungus that infected one of these cells? Again, it's kind of like they're riding this escalator and they're eventually going to fall off. So this is damage. Any damage that's done, most of it will be shed in the next few weeks. So that's why this is that's the benefit of this. Hopefully the dermis and you know the layer in deeper is not going to be harmed. It'll just be the epidermis that's harmed, and you're going to make a whole new one. You're making it right now. So that's the big advantage. What are the cells that make up the epidermis? Well, of course, we mentioned the keratinocytes. Most of the cells are these epithelial cells, but there are a few other cells here. So one is, they're called melanocytes. Where are they? So here's the melanocytes. They're actually much cooler looking than that. They actually look like a little octopus, but that's okay. They make melanin, and different people, I think they either have more melanocytes, but it all depends on, you know, where your ancestors came from. In the Start Here video, from the speaker points out that people who are very pale, well, their ancestors came from northern latitudes where there wasn't a lot of sun, and if they wanted to make vitamin D, they needed to have pale skin so they could take advantage of what little sunlight there was. People who lived closer to the equator had plenty of sun. They needed more melanocytes so that they didn't get excessive UV damage. So anyway, so pigment, and that's the job of the melanocyte. Langerhans cells, those are macrophages, and we've talked about monocytes and macrophages. Monocytes are kind of like the highway patrol, and macrophages are kind of like the border patrol. They're the same cell, it's just that when monocytes reach a particular organ, the liver, the brain, the skin, we give them a different name. I don't know why, but they are the resident macrophage. So the macrophage that lives in the skin is called a Langerhans cell. And again, if you've got some sort of infection of your skin, it would go and find it and eat it, and then migrate to a lymph node and present antigen to the B cells and all that. There's one more type, which we don't really need to know. They're called Merkel cells, and they're just associated with touch. And that's this little guy here. And then there's the Langerhans cell. To memorize the layers of the epidermis, I mean, I'm not going to ask you to name the layers of the epidermis, but still you should know the layers. I mean, I may ask a question where you're going to have to realize, well, what is the outermost layer? So in that video we watched, you can use "come, let's get sunburned." You know, come being stratum corneum, L being lucidum, G being granulosum, S being spinosum, and B being basale. Now, bear in mind that for most animals, there's really only 3 layers: the stratum corneum, the stratum spinosum, and the stratum basale. I guess you could argue there's, you know, you could argue that some animals have a stratum granulosum, but anyway, but I think you'll find it helpful if you can at least remember the stratum corneum refers to the outermost layer, and the stratum basale refers to the innermost layer. Mainly because when you do see, you're going to see some skin problems, they seem like they usually affect either the stratum corneum or the stratum basale. Again, the innermost layer right there on, you know, that's where the new cells are being made because it's mitotically active. So we mentioned that there's a lot of good things about this epidermal turnover, but we also get things like dandruff. Dandruff, those are keratinocytes, just these sort of excessive numbers of keratinocytes. So what do you think? When you see a patient like this who has scale, i.e. dandruff, is this caused by increased epidermal turnover or decreased epidermal turnover? And what I mean is this process that you're seeing that normally takes 20 days in an animal, is it happening in less time, like 10 or 12 days, or is it happening, is it taking longer, like 30 days? What do you think? Again, this process here, right? Right? This process, is it happening faster so that it turns over in 10 days, or is it happening slower? What do you think? Well, it's happening faster. And so anything that makes this process happen faster, you end up seeing this excessive scale. And this is something you'll see in patients that are very itchy, or we should say pruritic. So why do you think we see scale on patients that are very itchy? Well, all that itching, the skin responds by increasing the epidermal turnover rate. And so we just, I don't know the reason why, maybe just it's a way of dealing with inflammation or irritation, is to increase how rapidly these cells are made. Okay, the next layer down is the dermis. Now the dermis is where we find, well, there's some things that are different. Okay, so you look, here's the dermis. What are some things you see here that were not in the epidermis? Well, there seem to be a lot of blood vessels, right? These red things we'll assume maybe are nerves. There's some hair follicles that go down into the dermis. There's this, what is this? This is some sort of a gland, right? So these are all things we find in the dermis. Oh yeah, and those erector pili muscles I told you about, the ones that cause your hair to stand up. Those muscles are located here too. Actually, that's this thing right here. That's the erector pili muscle. So when that contracts, it makes the hair stand up. And then all this yellow you're seeing here, that's connective tissue. That's collagen, right? Collagen is what gives your skin kind of its shape. And that's actually made by a little cell called a fibroblast. Next year, when you learn about wounds and wound healing, you'll learn a lot about fibroblasts. That collagen is essential, an essential first step for wound healing. And I think you'll find this interesting. I think it's interesting. Plus, it helps you understand the dermis. So, so I want you to ask yourself, why do you think tattoo ink has to go into the dermis and not just the epidermis? Does it hurt? Yeah, I've heard that it hurts. Well, it hurts. So is it a good idea to take aspirin or Advil before getting inked? No, it's not a good idea. And what keeps the ink in your skin? And finally, how does laser removal work? So let's answer those questions and we'll watch the science of tattoos.
Nearly 1 in 5 people in America has a tattoo. So these permanent, portable pieces of art are clearly an important part of our culture. But how do they work? What makes a tattoo permanent, and can you really get rid of it? Well, tattoos work by taking advantage of the structure of your skin and the composition of the ink that's used. Your skin, for starters, is made up of 3 main layers of cells. On top, there's the epidermis, which is exposed to the environment. Below that, there's the dermis, and it's full of hair follicles and sweat glands. And below that, you find the subcutaneous layer of fat and connective tissue. The tattoo needle drives the ink all the way through the epidermis, but it doesn't actually inject the ink. Instead, it's coated with pigment, kind of like a paintbrush, and the ink is absorbed through capillary action. It just gets sucked down through your tissues into the dermis. This is deep enough that the ink won't just flake away as you lose skin cells from your epidermis over time. And it's also why getting a tattoo hurts. The dermis is full of nerve endings that sense pressure, temperature, and pain. So jamming a bunch of tiny needles into that layer activates a lot of those receptors. Some people say that getting tattoos on bony areas hurts the most because there's no fat to act as a cushion. But there's not really any scientific evidence to back that up. You can probably safely assume that your most sensitive body parts, like the hands and face, would be pretty painful to have tattooed because they have the highest density of nerve endings. Now, even though getting a tattoo can be pretty painful, many tattoo artists recommend that you avoid taking painkillers, even aspirin, before your session. That's because those drugs can thin your blood, which makes the tattooing process more difficult. Thinner blood means that the needle causes more bleeding, making it harder to see the area that's being tattooed, and that just makes things harder for the tattoo artist. So save the aspirin for after your art is done, and it'll take a few weeks for your skin to heal. Getting a tattoo triggers an immune response in your body, which tries to attack the ink as if it were an infectious invader. Normally, your white blood cells clean up after an injury, breaking down and gobbling up any foreign matter. And your white blood cells do manage to clear away some of the smallest particles of ink, which is why a new tattoo fades in the first couple of weeks. But most of the pigment particles are too big to get eaten up and cleared away. So whatever your white blood cells can't eat up gets absorbed by nearby connective cells called fibroblasts. And the ink just sort of hangs out in there forever, which is why tattoos are pretty much permanent. Mostly. Fact is, even the most awesome tattoo will fade with time. As your skin ages, your fibroblasts die off and are replaced with new ones, so over time the ink migrates a little as the cells turn over. Fading can also be caused by sun exposure. The UV rays and sunlight break down the tattoo pigment, so more of it can be cleared away by white blood cells. And of course, if you end up with a truly terrible tattoo, or maybe you just don't love Limp Bizkit as much as you used to, we do have the technology to erase your tattoo. Mostly. Laser tattoo removal works by using heat to break up the ink pigment particles into even smaller pieces. Then your white blood cells can finally clear them away just like they always wanted. But the color of your tattoo can determine how hard it'll be to remove. Black tattoos tend to be the easiest to get rid of because they absorb almost all wavelengths of light, so they heat up and break apart when treated with pretty much any wavelength. Other colors, like red, green, blue, and white, require special lasers to make sure that the wavelength being used is the one that will be most easily absorbed by the pigment. But even with the proper laser, tattoo removal doesn't remove all of the ink. And on top of being extremely painful, it has its own risks, including scarring. So if you're going to get a tattoo, don't bank on being able to get rid of it if you change your mind. As tattoos become more mainstream, we can hope that we'll be able to develop better inks and improve our removal techniques. But in the meantime, like I always say, think before you ink. Thanks for watching this episode of SciShow, brought to you by our patrons on Patreon. If you want to help support the show, just go to patreon.com/SciShow, and don't forget to go to youtube.com/SciShow and subscribe. Human body.
All right. That's great. So you see that a little bit of immunology shows up there, right? The macrophages and the immune system, and then some fibroblasts. So capillary action. It's very cool, I think. Again, so the fibroblasts, they make collagen, right? One of the main structural proteins in your body. They also will absorb ink. I don't know why they absorb ink, but they will absorb ink, and then they just kind of hunker down. I guess they must live a long time, and there's your tattoo. The final layer is called the hypodermis. I showed you this picture here just because this is part of why a cat can pick up its kitten without ripping the skin off. It's because we have this kind of unusual layer called the hypodermis. We use this layer for certain injections, right? So when you give a vaccine, right, you're going below the epidermis and the dermis into this large subcutaneous area here. Well, what's down here that's nowhere else? Well, there's don't appear to be a lot of epithelial tissue. There's not a lot of blood or nerve endings, no hair follicles. There's mostly just connective tissue. There's fat and lipocytes. I guess there's a few blood vessels and nerve fibers down here, but mostly connective tissue like fat. And again, that's kind of why in dogs and cats, we can take advantage of that. You and I think our hypodermis is not the same as a dog and a cat. And technically it's not part of the skin. It's part of the integument, but not part of skin. That's why they call it hypodermis, because it's below the skin. It's below the dermis. But we can take advantage of it for giving fluids. Again, trying to give sub-Q fluids to a human, I don't know if that's even possible. There wouldn't be much room. Dogs and cats have this very, and other animals too, have this pretty thick hypodermis that allows us to give fluids and things, right? Or to scruff. If someone had to scruff me, there's not much there to scruff. Well, let's put some of what we've learned into practice. We're going to talk about some of the neoplasias of the epidermis. So I'm going to show you some pictures labeled 1, 2, and 3. And based on what you know and what I'm going to tell you, I want you to try to guess which tumor or which neoplasia these patients have. Neoplasia, remember, refers to some sort of unusual growth, right? Unusual growth of cells. We learned last semester that there can be malignant neoplasias and benign neoplasias. So the 3 we're going to look at, one is called the basal cell tumor. And that's a tumor of the, I said the keratinocytes, that's the definition of the stratum basale. Now the stratum basale, that's that deepest layer. So maybe I should have said epithelial cells, but we'll just leave it. We'll leave it as keratinocytes. There's malignant melanoma, and that's a tumor of melanocytes, the cells that make pigment. And then the squamous cell carcinoma is a tumor that extends through all layers of the epidermis. All right, so these are our 3. So I'll show you the first neoplasia. It's black. It's growing from this dog's mouth. Which of these 3 is it? I'm going to show you the same tumor, but in a different species in a different location, right? So this is a gray mare, and she has all these, again, black lumps growing from her vagina and around her anus and under her tail. So which of those 3 is it? Our next neoplasia is very destructive. It's kind of eaten away at this little white cat's nose. We also find it's the most common tumor of cattle. So it's growing off of the 3rd eyelid here. We can even find it growing in like on a horse's penis, for example. This might be discovered during a routine sheath cleaning. All right, so then kind of a destructive tumor. And then our 3rd one is just sort of this soft, round, kind of purple lump that's growing. Doesn't seem to be bothering that cat. So, which is which? Well, this first one would be the malignant melanoma. And as I said, cancer or neoplasia refers to this aberrant growth, right? These cells that just are growing for no reason. In horses, we see it often in older gray horses, and you'll see these nodules under the tail, around the anus and the scrotum. In dogs and cats, they can be anywhere, but the most malignant ones we find in the mouth. And these definitely have a high risk of metastasis. So these are ones that can spread to the lungs, for example. Here, what we're seeing is called the squamous cell carcinoma. So there's that word squamous, which makes us think of the stratified squamous epidermis. These are often round, ulcerated lesions that seem to eat away the tissue. We see it on the 3rd eyelid. That's the nictitating membrane, on eyeballs, on the planum nasale, and ear flaps and nose of white cats. That's very key. White cats and white dogs. This is basically a kind of skin cancer. Even white-faced cows and horses, I think we see it more often. So sun exposure, UV light, even though the epidermis is supposed to be able to deal with it, sometimes it can't. It takes over the whole epidermis. And again, we see it in white dogs too. There's a variety of skin cancers they get. I'm sorry, when I say skin cancers, I should say cancers that are where UV light plays a role. And then finally, this one is the basal cell tumor. It's a very common tumor in cats. It's usually benign. And again, it's from cells that are found in that basal layer of the epidermis. And remember, you'll hear me say this, we miss more by not looking than by not knowing. You know, you're taking a horse's temperature, especially an older horse. Don't just take the temperature, look. You know, you might see a little nodule that could be important. All right, so that's the end of part 1 here. And again, if you haven't, you can go and you can check some of the questions in the quiz thingy, and then I'll see you in part 2.